And welcome to the rooftop, the blustery rooftop of St George's Hospital in South London, where more than 1,000 COVID patients have been cared for in recent weeks, and where today staff have gathered to pay their own unique tribute to the organisation they work for. But the support of the public has kept up morale and kept us going.
The scene at St George's Hospital, South London, with 72 marked out by NHS staff on the roof of the hospital on the helipad, marking this 72nd anniversary of the NHS, taking place, of course, in the middle of a pandemic, the COVID-19 pandemic. Well, earlier today, the chief executive of the NHS in England, Sir Simon Stevens, called for adult social care to be resolved once and for all. Our political correspondent Chris Mason reports.
The pride and gratitude for our carers has once again been there for all to see, but providing and paying for social care remains a colossal challenge.
The carers that work for ourselves and for the NHS have gone above and beyond.
Now, the head of the NHS in England says change must come quickly.
I would hope that by the time we are sitting down this time next year, on the 73rd birthday of the NHS.
In his first speech as Prime Minister, Boris Johnson made a big promise.
We will fix the crisis in social care once and for all.
That was very nearly a year ago now, and since then, political convulsions and then the coronavirus itself further exposing the challenges facing social care. The government acknowledges that there are complex questions that need addressing and a long-term solution is essential. But bluntly, the reality of this year so far has been wrestling with the short-term challenge of attempting to cope with a pandemic.
We protected the NHS during the peak of this crisis, and we will protect the NHS in the future. We are constantly ensuring that the NHS has what it needs, and just the sums of money that the Treasury have put into the NHS over the last few months have been unprecedented.
In Scotland, free personal care is available. Some care costs are capped in Wales, and home care is free for the over 75s in Northern Ireland. In England, the government says billions of pounds of funding has been made available. Labour say money coupled with a strategy is what's needed.
We need an immediate package of support. The virus isn't over for social care, and we need the long-term changes that provide services with the right funding so that everyone knows as they get older, if they need care and support, it will be there for them.
For decades, governments have promised to improve social care. The big question is whether COVID-19 will be the spur for real change. Chris Mason, BBC News.
The Department of Health and Social Care has said that another 22 deaths of people who tested positive for coronavirus took place over the last 24 hours. That is when they were recorded, and it brings the total number of those who have died during the pandemic to 44,220.